go jam so too. When the bed to the enter body, all the girl them go shake their body, go shake their body. Oluwa bona mo belly, mo bona belly. You know the money you take up police, me and they love you gone.
Hello everyone. Ndewo no. Ekabo. Sanunku Dezua. And welcome to World Cancer Day 2021. My name is Dr. Dalentina Esiaka, and I am so excited to be your host and moderator for today's event. A little bit about myself. I am a visiting assistant professor of psychology at Union College, Schenectady, New York, where I also serve as the principal investigator for health and aging from Minority Perspectives Lab. But before I moved to the USA, I spent roughly 8 years in University of Nigeria, Nsukka, where I got my BSc in psychology as well as a diploma in social work and community development. So if you're from Nsukka and you're here today, Idokwoyi, Adomoyi Keteke. All right, this is a special program in recognition of World Cancer Day. And this program is brought to you by Project Pink Blue Health and Psychological Service Center, Abuja, in conjunction with the Society for Integrative Oncology. The mission of the Society for Integrative Oncology is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people impacted by cancer. And get this, the society invites and welcomes African membership. So as I'm talking to you, there is information about their site displayed on the screen. I encourage you to take out time later today, whenever you feel up to it, to visit their site and learn how you can take part in this fight against cancer. We need every hand where we fit get. This fight for against cancer no be one person own, no be one man fight. We need everybody wey fit contribute, no matter how small, it go help us fight this war against cancer properly, especially as we recognize the impact and the destruction that cancer wreaks on Nigerian communities. Then we'll begin to recognize the importance of joining the fight against cancer.
Good morning, good afternoon, good evening all. I am Banwo Khadijat, Project Supervisor at Project Pink Blue. I am an 11 years old breast cancer survivor, certified oncology patient navigator, advocate and recipient of 2020 Euro of Hope Patients Award. On behalf of Project Pink Blue, I welcome our guest speakers and participants to 2021 World Cancer Day webinar hosted by Project Pink Blue. This webinar is proudly sponsored by Society for Integrative Oncology United States. Thanks to the entire team at Society for Integrative Oncology for identifying with us and always ready to give us technical support.
I'm Dr. Santosh Rao, and we at the Society for Integrative Oncology are delighted to participate in World Cancer Day 2021. SIO is very interested in reaching out to our international community, and we are proud to have increased involvement from Africa. Please visit our website, integrativeonc.org, where more international content is planned. We appreciate the opportunity to work with Project Pink Blue on this webinar focusing on cancer prevention and risk reduction.
Today, we have invited our internationally recognized cancer experts to tell us how we can prevent cancer as well as reduce our risk of cancer. The experts we have on for you today include Dr. Eleanor Walker, Dr. Santoshi Narayanan, and Miss Marsha Banks Herods. And subsequently, I'm going to have the opportunity of introducing them to us and them having to talk to us to tell us how we can prevent the risk of cancer. And this conversation surrounding cancer is really a timely and important conversation in Nigeria. This is especially important when we recognize the impact, the havoc that cancer wreaks in our community, as also when we recognize the increasing number of cancer incidents and deaths of Nigerians due to cancer. Then we begin to see that this is a conversation that we must have, and we must have it right now. For today's show, we're going to focus on 4 main cancer types, most common cancer types in Nigeria: breast cancer, cervical cancer, prostate cancer, and colorectal cancer. So without wasting much of our time, it is my pleasure to introduce to us our first speaker for the day, Dr. Eleanor Walker, who is going to be talking to us about early cancer detection and cancer screening. So let me tell you a little bit of Dr. Walker, a little bit about Dr. Walker. Dr. Eleanor Walker is a senior staff physician at the Henry Ford Cancer Institute in Detroit, Michigan. She's also the medical director for the Center for Integrative Medicine at Henry Ford Health System, as well as division director of the breast services in the Department of Radiation Oncology. She serves on the board of trustees of the Society for Integrative Oncology and is also the co-chair of the Society for Integrative Oncology, Health Equity and Inclusion Task Force. Her clinical interests include breast, prostate, radiosurgery, and cancer incidence and treatment in minority populations, as well as special research interest in breast cancer and integrated therapies. Her care's philosophy is, I believe in treating each patient as if they were my own family. Please join me in welcoming Dr. Eleanor Walker.
Thank you, Dr. Escada, for that kind introduction. It is my pleasure to be here today. Project Pink Blue is doing such great work on behalf of cancer patients and survivors, and especially creating awareness around the importance of screening and early detection, which, as you can tell, what I'm here to talk about today. Specifically, we'll discuss breast, cervical, prostate, and colorectal cancer. So let's start at the top. What is a cancer? Cancer develops when cells in a part of the body go out of control. Although there are many types of cancer, they all start because of an out-of-control growth of abnormal cells. Most types of cancers form lumps or masses called tumors, but not all tumors are cancerous. Some are benign, and then there are the malignant cancerous ones, which can be life-threatening. The spread of cancer to a new location is called a metastasis. There are 4 classifications of cancer. Carcinomas, which are tumors, growths, lumps, or solid masses. Sarcomas are malignancies of the soft tissues or supportive structures of the body, for example, the bone or tendons. Lymphomas are malignancies of the lymph nodes, and leukemias are malignancy of the blood. Within, there are multiple types of cancers within these categories. Let's look at Nigerian statistics. There are 10 main causes of death in Nigeria, and diarrheal diseases and malaria lead the pack. But as we see, neoplasms, which are malignancies are number 6 on the list. So in Nigeria, we know that cancer is rapidly increasing. Cancer is the second leading cause of death, especially among African Americans after heart disease in the U.S. And we know that 1 in every 4 deaths is due to cancer in the U.S. So the American Cancer Society estimates that 1.9 million new cancer cases will be diagnosed in 2021, and 608,000 plus individuals will die from cancer this year. Let's look at Nigeria. So your population is about 200 billion. And what we are seeing is and this was from the year 2019, there were a total number of almost 116,000 cancer cases. And of those, a good percentage, 70,327 died. And the most common cancers that were seen in your country is breast cancer, cervical cancer, colorectal cancer, and prostate cancer. So these numbers are showing that there were premature deaths from this in about 289 plus thousand in 2016, or 18.2% of patients. And what was attributable to these cancers, including tobacco use, alcohol use, infections especially, obesity, which is also increasing in Africa, UV radiation, and occupational hazards. But the good news is cancer is survivable if it's detected early. And the American Cancer Society estimates that some of all cancers can be prevented by lifestyle changes and early detection. What are common signs and symptoms of cancer? Well, if you find a thickening or a lump, unusual bleeding or discharge, hoarseness in the voice or a nagging cough, unexplained weight loss or gain, an obvious change in a mole or a wart, maybe you have a sore that won't heal. If there are changes in your bowel or bladder habits, indigestion or difficulty swallowing, fatigue and tiredness. But please note that cancer can be silent and may have no symptoms whatsoever. So let's talk about breast cancer. Breast cancer is the most common malignancy in females worldwide, with at least 1.4 million cases diagnosed per year. It is the major cause of cancer-related deaths in both developing and developed countries. And in Nigeria, the incidence of breast cancer has steadily increased from 1976 to 2012, especially in younger women. But we know early detection is the key to survival. When found early, breast cancer cure rates are high in the U.S., as high as 97% in some cases. So what are the risk factors for breast cancer? Well, age, family history of a previous breast cancer, your race, your menstrual history, early onset of menses and late menopause, pregnancy history. If you've never given birth, you're at higher risk, and we know hormone replacement therapy also contributes to it. The hallmark of breast cancer in Nigeria is late presentation. In Nigeria, breast cancer is a disease of younger women, a mean age of 48, whereas in the U.S. it's a disease of postmenopausal women. In the advanced stage in Nigeria, there is less than a 10% survival rate. The reverse is the case in the U.S., where breast cancer is primarily a disease of postmenopausal women. In the U.S., the overall 5-year survival rate is more than 90% and still continues to rise even with the rising incidence of breast cancer. So I just wanted to put some pictures here to show you comparing Nigeria to the U.S. In Nigeria, I told you late presentation. So a patient may present with a palpable mass, ulceration of the skin, peau d'orange changes, adenopathy, and swelling of the breast, which you see here. And this is a CAT scan looking at these changes and the mass centrally. In the U.S., typically, most breast cancers are found on screening mammograms, such as this one, and an ultrasound. In Nigeria, only 12.2% of patients present early. The vast majority, 74.4% of patients, presented with locally advanced disease, while 13.4% have distant metastasis involving the pleura, the liver, the lung, the bone, and the brain at presentation. In the U.S., early detection is important, which is why the American Cancer Society recommends that women 40 and older get an annual mammogram and an annual clinical breast examination by a healthcare professional. And although they no longer recommend that women in the U.S. do self-exams to find a breast cancer, women should. All women should become familiar with both the appearance and the feel of their breasts so they notice a change. And I think that's particularly important in sub-Saharan Africa, where mammograms are not readily available. You should have clinical breast exams and you should know your own breasts, especially women who are at increased risk with family history or a genetic tendency or a past breast cancer. So again, ladies, know your breasts. Treatment is by stage. With early stage, you have a choice of mastectomy, or what we call breast conserving therapy, where you're able to just have the mass removed, the lymph nodes checked, and get radiation, as opposed to removing your whole breast. In later stages, stage 3 and 4, many times a mastectomy is required. And in each of these stages, depending on the extent of disease and certain markers, treatment may also include chemotherapy and or hormonal therapy. Prostate cancer. Its incidence varies greatly across the world, reflecting different genetic factors, dietary, and other environmental influences, local screening, and diagnostic practices. Worldwide, prostate cancer is actually the second most frequent cause of cancer deaths and is the commonest cancer diagnosed among Nigerian men. It is estimated that 1/3 of cases of prostate cancer can be prevented and another third can be cured if detected early through screening. So again, I want to put up this chart comparing prostate cancer in the U.S. and prostate cancer in Nigeria. So in Nigeria, it is most common and it is the most deadly cancer in men. Its death rate is more than double the mortality that we see in the U.S. and North America, with an estimated 80% of Nigerians incurable at diagnosis. The median age of patients at diagnosis is 70. Now in the U.S., it is the most frequently diagnosed in African American men or men of African heritage. It is the second leading cause of cancer death after lung cancer in African American men, and African American men have the highest incidence and are more likely to die of the disease than men from other ethnic groups. So what are the risk factors? Age. Most men in the U.S. are diagnosed between the ages of 50 and 74. Your race in the U.S. makes a difference if you are of African ancestry. If you have a family history of first-degree relatives with it, puts you at a higher risk. And if you eat a diet low in fiber and vegetables and fruit consumption. But early detection of prostate cancer is important. That includes a digital rectal exam beginning at age 40. We recommend for African American men. The PSA, or prostate-specific antigen blood test, again beginning at age 40 in the U.S. for African American men because of their higher risk. And if you find something, a transurethral ultrasound to biopsy the prostate. And when we think of stages of prostate cancer, there's localized prostate cancer that has no sign that cancer has spread outside the prostate. Regionally, when cancer spreads to the outside of the prostate to nearby structures or lymph nodes, and distant disease is when it has spread away from the prostate into the bones, the liver, and the lung. So, what are the reasons that men don't get screened for prostate cancer? Well, in Nigeria, we know that a lack of knowledge of prostate cancer is very high. Also, in both countries, there's a fear of diagnosis leading to a loss of manhood. There are perceptions of stigma associated with prostate cancer screening, which act as a barrier preventing Black men from discussing screening. Delayed screening due to the belief that prostate cancer screening automatically includes a digital rectal exam, and fear that they will receive a positive diagnosis and lose their virility due to the treatment of prostate cancer. There's a fear of death if diagnosed. They may die during the surgery. Many people believe that the use of traditional medicine alone will lower their PSA, so they don't need to be screened. Well, they don't need to get treatment if they are found to initially have a high PSA. They believe that patients believe that God will cure them, so they don't need to follow through. There are financial costs, and others talk about the need to care for other family members before themselves. So treatment options for prostate cancer vary. If you have early stage 1 or 2 disease, you can either have your prostate removed or you can have radiation therapy. If you have regional disease, stage 3, then radiation and hormone therapy is indicated. For stage 4, hormone therapy and palliative radiation and chemotherapy is sometimes used. But if you remember what I said earlier, a healthy lifestyle with a low-fat diet, healthy body mass index, and daily exercise may decrease the risk of prostate cancer. And this is just a slide showing you the 5-year survival rates if you have early stage, which is localized, or even sometimes regional disease. Whereas once you have distant disease, it drops, the 5-year survival drops to 31%. Now let's talk about colorectal cancer, which is the 3rd leading cause of cancer-related death among African Americans. What has been noted recently has been the increase in the incidence of colorectal cancer in the northeast region of Nigeria, which, like the rest of the country, with a male predominance and a rectal cancer predominance. Colonic cancers are still rare as compared to Western countries and are seen in much younger age groups in northeastern Nigeria. More than half the patients present with advanced disease. In the US, men are more likely than women to develop colorectal cancer and die from it. African Americans in the US have a higher incidence and mortality rate than other ethnic groups. Colorectal cancer in the US tends to be a disease of the elderly, with the majority presenting over the age of 75. And we know that this incidence increases with age and doubles every 10 years after age 40. Although recently we have been noticing an increase in younger patients under 50. So the risk factors for colorectal cancer include age, race, heredity, the history of a previous colorectal cancer, if you have intestinal polyps, chronic inflammatory bowel disease, diabetes, and a diet low in fiber, vegetables, and fruit consumption. Early detection includes fetal occult blood tests, beginning at age 50, although this has been pushed up to age 45 given the increase in the US of younger patients developing this disease. Sigmoidoscopy every 5 years, which looks at the rectum and the left side of the colon. Colonoscopy every 10 years, which looks at the whole thing, and double barium contrast enema every 5 years if indicated. The treatment of colorectal cancer, well, for colon cancer includes surgery and chemotherapy as indicated. If it's a rectal cancer, it usually includes surgery, some form of radiation, and chemotherapy. So how can we prevent colorectal cancer? By limiting red and processed meats and eating more vegetables, fruits, and whole grains. Not drinking alcohol or smoking may help to reduce the risk. Increasing the amount and intensity of your physical activity may help reduce your risk, and staying at a healthy weight may also reduce your risk. And lastly, let's talk about cervical cancer. The incidence and death rates have decreased over time in the U.S. due to Pap smears, with a 75% decrease in the last 50 years, as you can see from this graph. We know one of the major risk factors for cervical cancer is the human papilloma virus. We also know that women who were born between 1938 and 71, while their mothers received a drug, DSE, to prevent a miscarriage, also have an increased risk. Infection with chlamydia or herpes simplex type 2, which are sexually transmitted diseases, can put you at a higher risk. If you have a first-degree relative, mother or sister with a history of cervical cancer, that also increases your risk threefold. Conditions that weaken the body's immune system, such as HIV and AIDS, smoking, and low levels of folic acid. How do we screen for cervical cancer? Well, in the U.S., it is recommended that cervical cancer screening begin at age 25 or at the age when you become sexually active. For those who are 25 to 65, they should have a primary HPV test every 5 years. If that's not available, screening can be done with either a co-test that combines HPV testing with a Pap smear every 5 years or a Pap every 3 years. Now, we know that in sub-Saharan Africa, typically it is a visual acetic acid test is performed. And if this is positive, then a Pap smear is obtained because of the high cost of Pap smears in these countries. Since there is a high association of HPV, the vaccine is very important to prevent cervical cancer, and it is recommended that you get it. The most important thing to remember is to get screened regularly, no matter what test you get. Now, how do we treat cervical cancer? Well, when it's early stage, it's surgical resection of the cervix or radiation therapy. In more advanced stages, radiation and chemotherapy is indicated. Use some pointers on how to reduce your risk of cancer. Number 1, stop smoking. 2, eat a diet rich in fiber. Eat a variety of fruits and vegetables every day. Try to eat foods that are low in fat and limit your alcohol consumption. Be more physically active and maintain a healthy weight throughout your life. Get the HPV vaccine, which is especially important in teens. And see your physician and get screened. Thank you for your time. Have a wonderful rest of your conference.
Thank you so much, Dr. Walker, for that informative and excellent talk. Just like you've shown us today, we can never understate the importance of early cancer detection behaviors such as cancer screening and HPV vaccination. Not only will they help us avoid fatal cancer stage diagnosis, they also help us improve our chances of surviving cancer diagnosis. So thank you so much for that enlightening presentation. So now it is my pleasure to introduce to us our second guest of the day, Dr. Narayanan, and she will talk about the importance of lifestyle in for the fight or in helping us reduce the risk of cancer. And just to tell you a little bit about Dr. Narayanan before she takes the stage, Dr. Santoshi Narayanan is an assistant professor in the Department of Palliative, Rehabilitative, and Integrative Medicine, Division of Cancer Medicine at the University of Texas MD Anderson Cancer Center in Houston, Texas. Dr. Narayanan joined the University of Texas MD Anderson Cancer Center in 2015, and this was after serving in both private practice and academic medicine. She practices integrative medicine and focuses on integrative therapies for symptom management in cancer. Her research interests include mind-body techniques and yoga in the care of cancer patients. Dr. Santoshi Narayanan is a member of the Society for Integrative Oncology. Again, please join me in welcoming Dr. Santoshi Narayanan.
Thank you, Dr. Isiaka, for that kind of introduction. I am pleased to be here today. And today I'm going to discuss about lifestyle factors and cancer risk reduction. So first, let's discuss the preventable causes of cancer. As you can see in this figure, there are several factors that are preventable, especially tobacco, alcohol use, and diet, physical activity, and also there are many other factors such as obesity, which is something that we can work on to prevent the risk of cancer. So first, I would like to focus on the obesity, and then we'll talk a little bit about diet, then we'll talk about exercise, then we'll talk about sleep and stress, and see how we can work on these factors with small steps at a time and reduce cancer risk. So obesity is associated with many cancers, especially as you can see in this diagram, there is esophageal cancer, liver cancer, kidney cancer, the risk of which is increased by obesity or being overweight, but also other cancers such as colon, prostate, breast cancer, uterine cancer, ovarian cancer, and some of these cancers, especially colon, breast, is high, and the incidence is higher in Nigeria. So what is obesity? So obesity is being overweight, and we calculate that by using a parameter called body mass index. And if you discuss with your physician, they will be able to tell you what is your BMI, or you can calculate it yourself with your height and weight. And based on where your body mass index is, you will be classified into overweight or obesity or normal. Where you want to aim for is to bring your body mass index to below 24.9, but I'm going to say 25. So if you bring your body mass index below 25, that decreases your cancer risk. And the reason it is so is because obesity is related with chronic inflammation, and there are so many metabolic pathways which causes cancer, and therefore it is important to maintain an ideal body weight and body mass index. So next, let's look into nutrition, and you can see this plate, which is more than half filled with vegetables. This is how our plate should ideally look like. We should fill our plate half with vegetables, with some fruit, and you can see the animal protein here. There is a small amount of animal protein there. And you can see the nuts are also in small amounts because nuts are rich in calories. You don't want to be eating too much nuts because that will increase your risk of obesity. And you can see the other plant-based proteins, your beans, lentils, then you can see the whole grains. Whole grains are barley, teff, oatmeal, quinoa, and so many other whole grains that you can eat. And fruits, it's always good to eat more vegetables than fruits because fruits also are higher in sugar, but it's good to eat fruits, but always eat more vegetable compared to fruits. in terms of why eating a healthy diet or eating more plant-based is important is this has been shown in research. So you can see this figure that vegetarian diets has lower incidence of cancer compared to non-vegetarian diet. Here you can compare non-vegetarian versus vegetarian versus being vegan. And they also did research to see in patients with cancer, what are all the factors that increases the recurrence. And you can see that the vegetable intake, the higher it is, there is a lower risk of breast cancer recurrence. And similar studies have also been done in prostate cancer, where there is a relationship shown between the diet, especially the Western diets, and higher risk of prostate cancer, and other connections between the diet and prostate cancer. So again, I want to emphasize the importance of eating healthy. And what I mean by eating healthy, especially what World Cancer Research Fund and American Institute of Cancer Research are all recommending, is to make sure that we eat more vegetables, we eat less animal proteins. The lesser the red meat, the better it is. And other animal proteins that can be eaten in moderation are chicken and fish. And you can eat more plant-based, such as beans, lentils, nuts, and for carbohydrates, doing whole grains that we discussed before, and doing some fruits. So a combination of these to make it as a balanced diet is important in maintaining the ideal nutrition and reduce your cancer risk. So next is physical activity or exercise. Lack of physical activity is almost like smoking. It's as bad as smoking for us. And there is a lot of scientific evidence which shows that it's convincing that the physical activity can protect us against colon cancer, breast cancer, and uterine cancer. So what are all the physical activities that you can do? So in terms of aerobic exercise, you can do gardening, swimming, walking, dancing, cycling, or you can just do the household chores. But you want to make sure you do it for enough time. So how much is the right time? So if you're doing regular physical activities that I described, you want to do it for 150 minutes per week, which is, if you divide it into 5 days a week, it comes up to 30 minutes each day. Let's say if you don't like to do a slow pace activity, if you like something very fast, you can do vigorous activities such as running, for which you can decrease the amount of time that you spend. So 75 minutes of vigorous activity would be considered in a range which is acceptable in terms of the amount of physical activity that we are supposed to do. But again, these are the minimum amount. So if you want to do more exercise and more physical activity, that is always encouraged. So the other type of exercises that you want to do is called resistance exercises or strength training. Strength training involves lifting weights, using the bands, and strengthening the muscles, basically. And those are also important. And this is also important in cancer survivors and cancer patients to decrease fatigue. And stretching the body, either doing yoga or simple stretching or other forms of stretching, also helps with decreasing inflammation. So in terms of planning your exercise, do some aerobic exercises, resistance exercises, and do some stretching. And you want to do 150 minutes of aerobic and about 20 to 30 minutes of resistance 2 to 3 times a week. So sleeping. Going to bed on time and waking up at certain time, and every day having some kind of routine is very important, because sleep is where we kind of restore our immune system, work on inflammation reduction, our body regenerates, our mind regenerates. So you want to make sure you give yourself enough sleep. So having some consistent sleep schedule, doing some sleep hygiene, which is not staring at the TVs and cell phones before you sleep, and making sure you make sleep as your priority is good, because lack of sleep will affect the immune system, and you need a good immune system to make sure that even if you have cancer, the risk of there's a lot of beneficial effects in terms of your immune system working against the cancer. So another important factor is stress reduction. So as you can see in this cartoon, that this doctor is telling his patient that stress is killing you, you need an easier job, smaller house, and a different family. But practically, that is not possible. So we need to find another way of decreasing the stress. And that is where mind-body practices come in. So when I say mind-body practices, what do I mean? So mind-body practices basically kind of connect our mind with our body. So you can connect our mind with our body through several ways. One is you increase the focus or connection between the mind and body by using sound or by using breath. And that is what happens in meditation. So when your mind focuses in all directions, you're gently bringing it back to the sound that you're making or your breath that you're taking. But you can also use movement to connect your mind and body. That's what we do in yoga, Tai Chi, and Qigong. You can see people do Qigong, Tai Chi here, and also yoga can give you the same benefit. So what is the scientific evidence? So several studies have shown the benefit of yoga. So why should you do yoga? So yoga is going to give you both physical benefits and emotional health benefits. So the physical benefits comes from the stretching, comes from using the body, doing different postures, which helps with decreasing inflammation. Also, in terms of your emotional health, you're connecting your mind and body by using the movement. So your breath, your movement, and the mind, everything is getting focused. And that can be very powerful. And that can make a big impact on healing. And this is not only true for people who are diagnosed with cancer, but also for people who are trying to prevent cancer and lead a healthy lifestyle. Yoga can play a significant role in their health. So where do you get started? Of course, the lifestyle changes takes time. It cannot happen overnight. So I suggest getting started at a small possible way. And some of the resources we have at MD Anderson, I think you will be able to access as well from Nigeria, or is our website, mdanderson.org/integrative med center. We have some meditation recordings, we have yoga recordings, Tai Chi recordings, and Qigong recordings. So I hope it opens up, but if it does, please check it out and you can try that, or any other websites that you can find to do yoga. But I would just caution people with cancer when they are trying to do yoga, and if they have some limitations, for example, if they have cancer spread to their spine, or if they have cancer in the bone, just to be careful, discuss with your doctor and find out what you can and what you cannot do so that you're doing it in a safer manner. The same holds true for exercise recommendations. It is completely recommended to do exercise, especially if you have cancer, but check with your doctor to see what is the restriction, especially if they do surgery on you. You want to discuss with your surgeon. If you're on chemo, radiation, discuss with your doctor. Even if you're not on treatment, discuss and see what you can and what you cannot do so that you're doing it correctly. And if you're otherwise healthy and you don't have cancer, and if you don't have any restrictions, you can follow the recommendations that we discussed. So overall, what we discussed so far is in complete line with World Cancer Research Fund recommendations and also American Institute of Cancer Research recommendation. So the cancer prevention recommendations are basically multifold, but what we focused on today is eating a healthy diet and maintaining a very good or ideal body weight, and also limiting consumption of sugar, alcohol, and red meat. And we talked about exercise, and we also talked about other factors such as lowering your stress, sleeping well. But in addition to that, a couple of things that they recommend is if you're a mother, breastfeed your baby if you can. And just in case, if despite the lifestyle recommendation, if cancer happens, it's not your fault. So please discuss with your doctor and follow the recommendations. Do your cancer screening, get yourself treated appropriately, and continue to follow the lifestyle. So that will be the end of my talk today. I wish you all a good health and cancer-free life. And I am pleased to be here with you today. And thank you very much for your patient listening. And let's all fight cancer.
Thank you so much, Dr. Santoshi Narayanan, for that wonderful presentation. It was quite illuminating to learn about the simple lifestyle changes we can make to prevent cancer or reduce our risk of being diagnosed with cancer. But to add a little to that, it's important that when we're talking about individual responsibility towards having better health outcomes, that we recognize the role of social determinants of health in bringing about healthy lifestyle and health outcomes, especially given the Nigerian context. And to recognize the role of social determinants of health is to recognize that there are economic and social conditions in the environment where Nigerians live, work, play, pray, and age, which affects their quality of life, which affects their health and health outcomes and possibility of being diagnosed with chronic illnesses. And we're talking about factors such as economic instability, poverty, lack of work. We're talking about education, literacy. We're talking about neighborhood and built environment. What kind of neighborhood do people live in? What kind of hospital are built in those neighborhoods? What kind of stores do they have? What is the living condition within those neighborhoods that makes it possible for people to engage in all these wonderful lifestyle changes that we've talked about today? We are also talking about community and social and community context in terms of social support, in terms of being discriminated against for being diagnosed with chronic illness. And we're also recognizing health and healthcare access. We are recognizing that when it comes to the treatment of chronic illness, we are still struggling with having world-class healthcare centers that can provide world quality care to Nigerians. So it's important that we note that yes, individuals owe it to themselves to modify their lifestyle. We owe it to ourselves to engage in cancer screening and cancer preventive behaviors. But there are conditions that we find ourselves in, which kind of determines if we will be able to engage in those healthy lifestyle and for how long we'll be able to stick with it. And also talking about social determinants of health, it's important to also talk about the role of psychological factors, especially before and after cancer diagnosis in informing uh, chances of surviving cancer and even preventing cancer in Nigeria. So, for example, if we're talking about psychological factors that play a role in cancer prevention, we're talking about anxiety, the fear, right? Like we say in Nigeria, waiting man no fit kill am, right? But now we know what you don't know will actually kill you. But there are people who would rather not go to the hospital out of fear or out of anxiety of learning something negative from there. So they will rather sit back at home and deal with whatever symptom they have the best way they can to avoid going to the hospital and learning of whatever doom that might come out of that visit. And then when we also recognize that psychological factors play a role in treatment, we're going to recognize that people diagnosed with cancer are more likely to develop depression, suicidal ideation, and a whole gamut of psychological problems. And this does impact the ability to survive cancer and go through the treatment regimen. So, like I've said, it's important that given the Nigerian context, that we push to the forefront the role of social determinants of health, and that we also begin to recognize the gift of psychological aspects of treatment and how that can help us provide a more holistic and integrative care to Nigerians, especially when we want to have a Nigeria free of cancer. And just to tell you a little bit of why it's important that we talk about psychological factors, studies coming out from all over the world, from different parts of the world, shows that there are psychological services that people can engage with to improve their health outcomes. One is counseling. People who are diagnosed with cancer or who are going through cancer treatment can actually benefit from quality counseling. Another is Another thing that helps is support group, right? Having that support group, having the people around you, having your community, having your group behind you as you go through treatment is a very good thing to help people deal with the psychological implication of cancer diagnosis and cancer treatment. So it is not, when people are diagnosed with cancer, that is not the time to abandon them. That's not the time to ostracize them or discriminate against them or look at them like people plagued. That is the time we show up and show out for them and support them in any way we can. And lastly, another line of research out there shows that in a psychological process that can help deal with or help individuals cope with cancer treatment and diagnosis is mindfulness exercise. And when we're talking about mindfulness exercises, we're talking about things like meditation and yoga. Not only will they provide you with that calming and soothing effect to help your body achieve equilibrium, they will really help you. Meditation can help you deal with your anxiety and fear surrounding whatever you are going on, you have going on as you're going through cancer treatment or after you've been diagnosed with um, cancer. And just to also recognize the importance of psychological services for people diagnosed with cancer or people going through that phase, Project Pink Blue is currently raising money for the first ever psycho-oncological services in Nigeria. The first ever, hear that again, right? And it is really a good milestone. However, it requires all hands on deck, and I am challenging you in a good way. No be fight, oh, I'm just challenging you in a good way for you to find a way to support them, for you to find a way to stand beside them as they try to raise this money, as they try to create these psychological services that every Nigerian is going to benefit from. Every Nigerian diagnosed with cancer can benefit from. And just to summarize, I encourage you to become an active ally in the fight against cancer. And by doing that, we actually can come up with a better way of giving each Nigerian a fair chance at cancer treatment and cancer survivorship. And now we have a surprise for you. We are going to show you a short and relaxing yoga practice by Miss Marsha Banks Herods, who put that little video, short video, sorry, together for us to watch. So let me tell you a little bit about the instructor before we show you the video. Miss Marsha Banks Herod is a certified yoga therapist, a trauma center, trauma sensitive yoga facilitator, as well as the owner of Pies Fitness Yoga Studio in the Washington, D.C. area. She works with clients impacted by complex and microaggressive trauma, and also is the creator of the flagship yoga class, My Body Don't Bend That Way. She's also an electrical engineer and an officer in her church. Ms. Banks Herod serves as the chair of the Society for Integrative Oncology's Yoga Special Interest Groups, Diversity in Yoga, and Cancer Care Committee. And finally, she is on the Society for Integrative Oncology's Health Equity and Inclusion Task Force. Enjoy the video.
Greetings and welcome to My Body Don't Bend That Way, Yoga for World Cancer Day. Thank you, doctor, for allowing me this opportunity to serve today. This practice will be gentle, relaxing, and accessible. Please feel free to join me either in a chair or on a yoga mat. When you're ready, I invite you to bring your palms together at heart center and maybe close your eyes and just shift your energy inward. Recognizing that this practice, this mind body connection, permits us the opportunity to tap into a place of peace, a place that allows us to accept where we are in our lives, to be grateful for the abundance that resides in each one of us, to be grateful for the communities that we live in, to be grateful for everyone that makes up this world. Just a couple more moments here, settling into this practice, into this time just to connect, to honor this world. Gently lowering your hands down to your knees, and if you feel comfortable, fluttering your eyes open. Breathe in with me. Slowly exhale, lowering your right ear to your right shoulder, noticing maybe a stretch in the left side of the neck. Inhale your head back through the center. Exhale, left ear to left shoulder, and notice if there's any stretching that occurs in the right side of the neck. Inhale back through the center. One more time each side. Exhale, right ear to right shoulder. Maybe you'll notice a stretch in the left side of the neck, maybe in your left shoulder, maybe somewhere else completely different. Inhale back through the center, last side. Exhale, left ear to left shoulder. Notice if there's a stretch on the right side of the neck, maybe the right shoulder, maybe you feel it completely differently, or maybe you feel nothing at all. Inhale back through the center. Listen for the change. Exhale, take your gaze over the right shoulder and just notice how the twist feels in your neck. Inhale back through the center. Exhale, take your gaze over the left shoulder. Maybe you notice some stretching or twisting through the neck area. Inhale back through the center. One more time each direction. Exhale, taking the gaze over the right shoulder. Inhale back towards the center, last side. Exhale, taking the gaze over the left shoulder. Inhale back through the center. Awesome. Let's add our shoulders in now. Inhale, lift your shoulders up near your ears. Exhale, shoulders down and back. Two more. Inhale, lift your shoulders up. Exhale, shoulders down. Beautiful. The last one. Inhale, lift your shoulders up near the ears. Exhale, shoulders down and back. That was wonderful. Let's add a twist to our practice. Plant your right hand onto your left knee. Extend your left hand behind you and twist, looking over the left shoulder. Noticing how this twist feels in your body. Inhale back around towards the front. Plant your left hand onto your right knee, your right hand behind you, and twist, looking over the right shoulder. Inhale back around towards the front. One more time each side, right hand to left knee, left hand behind you, looking over the left shoulder, and then reaching the left arm around the back this time, allowing the left fingers to reach for the right hip. You decide how far your fingers reach around. Inhale, come back around towards the front. Left hand to right knee, right hand behind you. Look over the right shoulder. Maybe taking the option of extending your right arm around the back, right fingers reaching for the left hip. And just notice if you feel any stretching in this form. Inhale back around towards the front, planting your hands onto your knees. Inhale, offer your heart up towards the sky. Beautiful. Exhale, rounding the spine, looking down towards your core. One more, please. Inhale, take your gaze up, chest reaching forward. Exhale, rounding through the spine. Inhale back through neutral. Beautiful. Let's stretch our legs out a little bit, continuing with this relaxation, extending the right leg towards the right and the left leg towards the left, allowing your toes to come in towards the hip area. Inhale, float your arms up towards the sky. Turn towards the left and exhale, lower your chest down towards the left quadricep, allowing your hands to rest either on your shins, your ankle, or maybe the bottom of your foot, depending on where your body is this afternoon. Inhale, reach the arms up and overhead, turn towards the right. Exhale, fold over the right leg, listening to your body, allowing your chest to come down towards the right knee. Inhale, lift the upper body. Allow your palms to face forward. Breathe in with me and exhale, fold to the center, surrendering to where you are in your life, being grateful for all the support that you have. Two more intentional breaths here. Engage the core. Inhale, lift the upper body. Exhale, float your arms down by your side. Let's transition to bound angle pose. Allow your left and right foot to connect. The bottom of your feet will touch. You're welcome to hold on to your toes or your ankles. Breathe in with me. Slowly exhale, fold forward, allowing your forehead to come down towards your toes. Noticing any sensation in the spine, in your hamstrings. Two more breaths here. Inhale, lift the upper body. Awesome. We can do that together one more time. Breathe in with me. Slowly exhale, fold forward. Remember, you have the option of holding on to the toes or the ankles. Maybe your elbows will come down towards the floor. Two more breaths here. Inhale, slowly lift the upper body. That was amazing. Now join me if you would like by extending your right leg out towards the right. Let the sole of your left foot come to the inside of the right leg. Inhale, float your arms up and overhead. Turn the upper body over the right leg and exhale, fold. Remember your hands land wherever they land. Two more breaths here. Engage your core. Inhale, lift the upper body. Exhale, float your arms down by the side. Beautiful. And now we'll switch our legs. Go ahead and extend the left leg towards the left and bring the sole of the right foot to the inside of the left leg. Your left toes can reach in towards the left hip. Inhale, reach your arms up and overhead. Turn towards the left. Exhale, fold over the left leg, allowing the chest to come down towards the left quadricep. Two more breaths here. Engage your core. Inhale, lift the upper body. Exhale, float your arms down by your side. And now we'll transition to one of my favorite poses. It's called double pigeon. We'll start by bringing the left ankle on top of the right leg, stacking the left knee on top of the right foot. If this doesn't feel that awesome to you, you can straighten your right leg for this form. On the next inhale, float your arms up and overhead, palms face forward, and exhale. Fold through the center. Noticing the stretch maybe in the right outside hip. Engage the core. Inhale, lift the upper body. Exhale, float your arms down. That was awesome. Let's go ahead and switch. We're going to bring the right ankle on top of the left leg now. The right knee stacks on top of the left foot. Remember, you have the option of extending the left leg out in front. Inhale, float your arms up and overhead. Palms face forward. Exhale, fold through the center, allowing the forehead to come down towards the top shin. Beautiful. Engage the core. Inhale, lift the upper body. Exhale, float your arms down by your side and return the right leg on top onto the floor. Very nice. We'll transition to table pose now. So go ahead and swing your legs to the side. Take your time coming over to hands and knees. Stacking your shoulders over your wrist. Your hips are going to stack over the knees. Spread each one of your fingers so that they connect to each part of the mat. On the inhale, lift the core forward, bringing the tailbone up towards the sky. Exhale, round the spine, gaze towards the core. One more, please. Inhale, take the gaze forward, core reaching down, tailbone reaching towards the sky. Exhale, round through the spine, gaze towards the core. Inhale, back through neutral. And we'll take one downward facing dog together, planting through the palms, planting your feet into the mat. On the exhale, lift your hips up into the air into downward facing dog. Take your gaze forward, bend your knees and walk or jump to the top edge of your mat. Inhale, halfway lift. Exhale, fold, reach back down towards the earth. Inhale, reverse swan dive up, arms up and overhead. Palms come together. Exhale down through heart center. Allow your arms to come by your side, and we'll do one balance pose together. Balance helps us stay focused in life. Plant through the right foot. Let the left heel come to the inside of the right leg. Float your arms up and overhead, and maybe slide the left foot up the right leg. Palms come together. Exhale down through heart center. Release your arms by your side, left foot by the right. And we'll do that on the opposite side, planting through the left foot. Let the right heel come to the inside of the left leg. Slide the right foot up the left leg. Float the arms up and overhead. Right knee points towards the right. Bring your palms together. Exhale down through heart center and release. Right foot by left. Returning to our final standing form. So hang out here with me. This is our mountain pose, a pose that allows us to feel the strength from the earth, connecting our feet to the earth. Also notice the strength of elevating through the crown of our head, knowing that we have all the power, knowledge, and wisdom to overcome any obstacles that show up in our life. So 2 more breaths here, mountain pose. And when you're ready, allow your palms to come back by your side. Meet me at the top of your mat. We'll return back down to a seated position together. Inhale, float your arms up and overhead. Maybe take a slight back bend. Inhale, back through neutral. Exhale, swan dive down towards the earth. Forehead coming down towards your knees. Inhale, halfway lift. Hands come right below the knees. Exhale, plant your hands and step back into table pose. Lowering the left knee, followed by the right. And when you feel comfortable, go ahead and swing your legs to one side and meet me back in a seated position like we started. So make yourself comfortable here, bringing your hands back to your knees, maybe bringing your right hand to your chest, your left hand to your belly. Breathe in with me. Allowing the belly to expand. Exhale. Belly back to spine. One more. Breathe in. Expanding through the belly. Exhale, belly to spine. And inhale back to neutral. For our final moments together, you choose. You're welcome to plant your hands onto your knees, palms connecting with your knees or palms facing up. It's your choice. For today's practice, I will have my hands connecting to my knees. Maybe you want to close your eyes. Maybe you want to keep them open. It's all up to you. For our final moments, we'll just explore the relaxation that's present in our body, in our mind, and in our spirit, knowing that this practice called yoga allows us to reduce any stress or anxiety that may be present in our body, allows us to deal with unexpected challenges that occur in our lives. As you return to your normal breathing pattern, notice how different you feel compared to when we started this practice. Just 2 more breaths here, allowing the thoughts to pass on, no judgment. And when you're ready, flutter your eyes open, returning your hands together at heart center. And I want to thank you for this opportunity to serve you, to honor you on World Cancer Day. Please be well. I look forward to seeing you the next time. Thank you again for experiencing My Body Don't Bend That Way for World Cancer Day. Go in peace.
Thank you, Miss Banks Herod, for that beautiful yoga practice. It was so soothing and so relaxing, and I hope that everyone enjoyed it and participated as much as I did. It was really very soothing. At some point, I didn't want it to stop because it was calming and very relaxing. And with that, I would like to thank you for being part of this wonderful day put together by Project Pink Blue Health and Psychological Service Center, Abuja, and sponsored by the Society for Integrative Oncology. I would like to thank all of our guests today. Thank you also to our presenters. Thank you, Dr. Eleanor Walker. Thank you, Dr. Santoshi Narayanan. And thank you so much for that wonderful video again, Miss Marsha Herod Banks. And with that, we come to an end of today's event. And remember that as we mark the World Cancer Day today, that it is not just an event for us to come and go home. The fight continues at home. Every day that we wake up, the fight against cancer continues. And I implore you to take the take-home messages from all of the presentations today and see what you can do with it in your life and in the life of people around you. Let us be the change we want to see. Thank you and have a good rest of your day.
When the bed do they enter body, all the girl them go shake their body, go shake their body.